Hi, everybody. It's Dr. Paul from the East Ontario Health Unit with another weekly update on COVID-19. Today is August 24th, 2022. And as usual, I will start by sharing my screen and sharing with you the local statistics. Basically, in terms of overall cases, I'll show you in a minute. We're on the way down, but we still our hospitalizations have sort of stabilizing and sort of flattening at one level, and our positivity is a bit down as well. So I'm just going to go show you the actual graphs themselves. Again, you could see, we had a peak here down and then went up again. So we're up and down. These things change day by day. So we report these every couple of days. So, the trends to me are flat here, but again, still upwards. So I'm hoping to see a downward trend in that regard. We have not had any additional deaths since my last report, which is good. So it just tells us that we still have COVID activity in our area. In terms of percent positivity, that too has gone down a bit. It's stabilized around 10%. So that is something that we're going to keep an eye on. In terms of our institutional outbreaks, again, those are kind of, you could see a kind of tendency downwards, the up and down. But again, it takes a couple of weeks for everything to settle down. But you can kind of see that we were down a bit and up again. So hopefully we've got a few that are close to closing their outbreak. So again, that's something that we're going to keep an eye on. In terms of our wastewater, again, we're seeing flat. There's a flat sort of approach here in Cornwall. We see a flat approach as well in Hawkesbury. We also see a flat approach, downward approach in Castleman, and the same as Morrisburg. So those are indicators that are showing us things are going in the right direction. I'll go back to vaccines in a minute, but I'm just going to now go to provincial data. But let me just first show you where we are just at our trajectory in terms of the East Ontario Health Unit. And you could see again, this is, we peaked in July. And then we're on our way downwards. That is basically the trends. The green is the 7-day averages, and then the yellow bars are the daily case rate. So you can see that we have gone down in that regard. If we want to look at the sort of the overall Ontario numbers, again, for the same period, we are basically seeing sort of same trajectory upwards and a downward trend. That's a provincial one. In terms of our wastewater, you can see that we're flat here in terms of the provincial numbers, and what we're seeing is sort of a very long plateau here as compared to a peak. So I believe that it's going to go down slowly. Again, reflection of many infections, Omicron, BA.5 predominantly. If you look at the individual regions, so East is going up a bit. It's not us, so it's and this, don't forget, this takes Ottawa, Kingston, Belleville, Leeds into account as well. So we're going to keep an eye on that. At the local level, like I said, we're not following that trend, but we will be keeping an eye on it. We're seeing Toronto has flattened and a bit upwards here. So there is, for the most part, there is a flattening with the exception of a couple of areas, Central East and East overall. So that's something that we're gonna keep an eye on. And finally, in terms of the surveillance data that we have from the province, if you look at trends, so weekly positivity is on a downward trend. Case rates is on a downward trend across 20 out of the 34 health units. And case rates decreased this week for 5 to 7. And again, the 80 plus are the ones that have the highest case rate. Again, I've said that time and time again. We see it more in the vulnerable. They're vaccinated 3 or 4 times, but you get breakthroughs. But in most situations, and thankfully, we do not get severe disease. They have mild symptoms and it goes away. So that's good, and that's thanks to the vaccinations. Hospital admissions and deaths have decreased, as well as outbreaks in high-risk settings as well. And so, again, headed in the right direction, slowly but surely, as we move forward. Now, going back to our local data, so the other end of the equation now is vaccination. And we're now at 501,711 vaccines administered in our area. And again, we are still seeing a very slow uptake on fourth dose, primarily in people 60 and 70. We're now up to almost 70% of 80 plus, which is very good. But you could see sort of a downward trend across the board for the green, which is the fourth dose. Third dose, again, we're good in 60 plus. But then you see that it's quite low, and you know now that the third dose has also been recommended for 5 to 11-year-olds. So we're going to be monitoring that moving forward. But again, you could see that we're getting low. Again, it's still low. The majority of the people under 50 years of age have not received the third dose. And again, I've said it time and time again, that is something that is going to be important to boost the second dose, which is now starting to weaken in terms of its protection. I know a lot of people are waiting for the bivalent vaccine. That should be available probably next month. And again, we'll just wait and see when it comes and how we're going to roll that out. But I think that's going to make a difference, because that's going to be able to substantially prevent transmission of the Omicron variant as well. So that's something that we're preparing about. In terms of the other one of the other data pieces of data that I want to tell you, that across the province we've had very low uptake for the children less than 5 years of age for the COVID vaccination, and what we're seeing across the province is around 3.5% of kids who are eligible have gotten it so far. So it's very low, and we have similar numbers or ratios in our area as well. So I'm just telling parents out there, if you have questions about it, and I understand there's hesitancy, particularly in young children and babies, please speak to your healthcare provider. Go on evidence-based websites that you can get your proper information for that. And that's really sort of in a nutshell where we are with the current COVID situation in our area. Again, it's a slow decrease, but I see a downward trend. We're going to be monitoring it. We're going to be, again, our preparations really are, back to school, supporting our schools, getting our flu vaccine program ready for October. And as I said, we're preparing already to, in anticipation of a bivalent vaccine coming out over the next couple of weeks, to for sure get our mobile teams to go and support our local congregate care settings, our long-term care settings, our retirement homes, to vaccinate those individuals, fourth or fifth dose, depending on where they are. And that will be the bivalent, the new vaccine that contains the Omicron. And again, we're preparing to roll it out to the public as well shortly thereafter. So once again, thanks for all your cooperation and understanding. And I'm seeing people again out and about and enjoying life. I think it's good for the soul, and it's good for your health as well. So take care, and I'll talk to you next week.